Protect Medicare, and I am very appreciative of you all being here today. And so I will go ahead and introduce our first speaker, who is Dr. Correa.
Thank you so much. It is a real pleasure to be with all of you here. My name is Ricardo Graham, an endocrinologist and the medical director for the PASH Clinic. So as physicians, we are here to raise our concern about the loosening restriction of COVID-19 orders that was promoted by the governor and the leadership of the state. And these restrictions were reversed too soon. As physicians, we are warning them that loosening COVID-19 protections now before enough people get vaccinated will endanger health and safety and cause a rebound effect. The governor's actions threaten to prolong people's suffering and economic plan. Ending COVID-19 protection now before our work is done, vaccinating and protecting people, including our most vulnerable population and marginalized communities, is like spiking the ball on the 5-yard line. For the past year, too many people have struggled, sacrificed, and died to get at this point in the pandemic. We are close to eradicating COVID-19, but if we don't make the final effort, we are close to be back to what we were in last year. Arizona policymakers must resist the temptation to fly in the open door when we are starting to see the light at the end of the tunnel. We should focus on vaccinating more people, especially underrepresented minorities. We must continue to observe safety measures, and we must wear masks, continue physical distancing, and minimize crowd in the meantime. Otherwise, we are just rolling the welcome mat for COVID-19 to return with a vengeance. As you know, on March 5th, 2021, Governor Ducey announced that he will allow business to operate at full capacity. The legislators also introduced proposals that will allow businessmen with no requirements to wear masks. Our elected officials push to fully resume normal activities flies in the face of data and evidence. Facts and science show activities like indoor dining and not wearing masks in public, going to bars, increase the risk of infection and the spread of the disease. Acting like the pandemic is over is a big mistake. We still have a lot of work to do, and we still need the help of the community to continue and finally get over about this pandemic. I now like to introduce my colleague, Dr. Katie Harrell, to explain further.
Hi there, my name is Dr. Katie Harrell, and I'm a family physician in Tucson, Arizona, and CEO of Agave Community Health and Wellness. Listen, Arizona is not ready to loosen protections that can help save lives during this pandemic. Remember that Arizona has only vaccinated a small fraction of residents here. Roughly 10% of Arizonans have received both doses of the vaccine, offering full protection against COVID-19, and only around 20% have received a single dose. Epidemiologists and health experts say that between 70 and 90% of the population would need to be vaccinated in order to achieve herd, or what we like to think of in the medical community as community immunity. That's when we know that enough people have immunity with the vaccines to stop the spread of COVID-19 within the general population. Arizona is nowhere near this number right now, and we shouldn't be throwing gasoline on a fire that we're slowly starting to finally get control of. As physicians, we urge Governor Ducey and Arizona legislators to do the right thing and to listen to the science. The facts tell us again and again that until we achieve that 70% of vaccination rate in Arizona's population, that we need to continue to double mask, we need to continue to physically distance, and we need to take every precaution necessary to prevent the spread and further unnecessary death in our community. No one wants to end up back in square one, or even worse, with more people infected, more hospitalizations, and more needless deaths and suffering in our communities. We're not out of the woods yet, and it would be very, very foolish for us to act as if we are. Governor Ducey and our legislators must ensure that people are protected and that the cases are significantly down before removing safety measures that can reduce infections and save Arizonans' lives. I'd now like to invite my colleague, Dr. Dion Mills, to say a few more words about the loosening restrictions in our state.
It's too late. Thank you. It's too late. Hi, my name is Dr. Dion Mills, and I'm a board-certified obstetrician gynecologist working as an OB hospitalist here in the Phoenix area. I'd like to talk about what loosening these restrictions mean and what and who they might affect the most. We agree that with public health experts' warnings that about reopening the economy prematurely while cases remain high and too few people are vaccinated. We must also keep in mind that the more contagious variants and mutations of COVID-19 have already begun spreading. The more contagious B.1.1.7 variant of COVID-19 has been reported here in Arizona, and at last check, 35 cases have been confirmed, which is nearly doubled from the week before. Additionally, community disease spread remains high in 8 of Arizona's 15 counties, including our most populous Maricopa County, and transmission is substantial in 4. Getting rid of mask requirements and physical distancing in Arizona now would endanger a lot of people and disproportionately harm marginalized communities and essential workers. There are individuals who are more likely to have chronic conditions, more likely to work jobs that expose them to COVID-19, and less likely to have access to health care. In this pandemic, Latino, Hispanic people, and Native Americans in Arizona are hospitalized and killed at higher rates from COVID-19 compared with white people. A study also showed that essential workers, often in low-wage and public-facing jobs, are more likely to die from COVID-19. We need to focus on better strategies to increase vaccinations in our underserved communities rather than loosening the restrictions. Getting rid of protections that can save lives now when we are not ready is going to disproportionately hurt low-income, underserved, and underrepresented individuals, their families, and their communities. Before loosening safety measures, Governor Ducey must get all essential workers vaccinated and protected. It is not enough to say that we respect and honor them. We have to show that in our actions. Getting more people vaccinated is how Arizona can safely and responsibly get back to normal, not by ignoring the science and playing chicken with a virus. Until we vaccinate enough people, protect those who are vulnerable and most likely to be exposed and drive down infection rates, we are at risk of prolonging the suffering and delaying of our return to normal. Thank you. We are open for questions.
Thank you so much, Dr. Mills. It looks like we have a question from Nicole. I will unmute you so you are able to ask your question.
Okay, great. Thanks. I'm Nicole Garcia with Fox 10, and this is a question for any of the doctors. Dr. Harrell had mentioned achieving some type of community immunity before loosening these restrictions. We have some dates from Governor Ducey hoping to open up the vaccine appointments to people ages 45 and over, and President Biden hoping to open up vaccinations to the general public by May. Does anyone have a target date of when herd immunity might be achieved? Are we saying probably 4th of July people can gather, or what's the time frame that you guys think is realistic?
I can speak to that. Oh, go ahead, Dr. Mills.
Well, I was just going to say that there is no magic date. It's about how quickly can we get enough vaccines, and how quickly can we get everybody to have access to vaccines, and how compliant are we going to have our society be in getting the vaccines. If nobody is going to get the vaccine, it may not be till next year. If we can't have enough vaccines available, but if we have enough vaccines available and we have a high compliance rate, and we are working equitably to make sure that everyone is able to have access to the vaccine, it could be even sooner than July. The control is in our hands on that part of it.
Yeah, and just to piggyback on what Dr. Dion Mills just said, I mean, that she basically took the words out of my mouth. Being qualified to receive the vaccine is very different than accessibility to an appointment to receive the vaccine. And what we're seeing on the ground here in our pods that are distributing the vaccines is that there are many individuals who are qualified. We have many teachers, we have still frontline workers who are not vaccinated yet because of accessibility and receiving the vaccine.
And just to add another thing to Dr. Harrell, the other problem is education. So there are some vaccine hesitancy of population, mainly underrepresented minorities, and this is not being addressed very well. So we cannot talk about, yes, we have the vaccine is coming, but if we don't address in these communities what is the importance of getting vaccinated, it's just having a vaccine. So we need to transform or translate that vaccine to vaccination. And that's when we can talk about, as Dr. Mills said, herd immunity or community immunity.
Thanks for that question. I see a couple more hands raised. We'll go with Valeria first and then Christina. And also, if folks want to type their questions in the Q&A or the chat, please feel free to do that as well. But we'll start with Valeria.
Hi, Valerie Ponte with Telemundo Arizona. Good to see a couple of you guys here. I'm going to ask a question in English, but if possible, answer it in English and Spanish. You all well know our community and know that once these restrictions are lifted, people think we're back to normal. We can go in the streets and we are seeing it. So what would you tell these people that are not taking it seriously about the importance of what steps need to be taken next? And what measures we need to take to finally say, okay, the pandemic is under control?
Yes, so great question. And this is where education of the community is the most important thing. This is where we have to tell the people the reality about what we have when we get the vaccine, and that we still need to be protecting others until we get to this point where a lot of people are immune. So I will still recommend to tell people that if you get the vaccine, we still need to continue the measurements of using mask and gathering, restriction in gathering and restriction in physical distancing until we're in a point where we can get the vaccine. Para la comunidad hispana es muy importante tener en cuenta que vacunarnos no significa nada más que ya se acabó la pandemia. Todavía hay mucha más gente que requiere la vacuna para poder llegar a ese estado donde, digamos, ya regresamos a la capacidad de antes. Mientras que no lleguemos a ese punto, que puede tardar unos meses más dependiendo del tiempo que tarde en las personas en vacunarse, entonces deberemos seguir usando mascarillas, deberemos seguir usando el distanciamiento físico y tratar de no conglomerarnos. Es muy, muy importante tener esa educación, porque si no, vamos a regresar a lo que teníamos antes, que era tener ese pico y esas personas hospitalizadas y muriendo en los hospitales.
I just have one more follow-up question. This week, I've heard more than ever of the Latino community, various people, including some teachers, who say they don't trust the vaccine yet because they say, how is it possible that in less than a year they could have come up with a vaccine to partially immune us? What would you tell them about the importance of getting vaccinated and trusting the vaccine?
So, sorry, Dr. Mills, go ahead.
Go ahead.
So the technology that the vaccine was built on has actually been investigated for the last several years. So this is not new technology. It's just the fact that this technology was in place for us to be able to utilize as researchers to be able to develop the vaccine. So yes, while the vaccine, I understand the image that, you know, the general public is seeing is this brand new vaccine that really was just rolled out this year, but the actual research that laid the foundation for this vaccine to be developed is not new, and it has been studied for a very, very long time. And so what I would really like the general public to know is that this has been well studied. The mRNA technology and nanoprotein technology has been very, very well studied. And it just so happened that the coronavirus gave us a platform to really be able to test it out in larger scale studies. And that those studies have shown, and I was actually a part of some of these studies. I was in the Moderna trial myself. I mean, that's how much faith I put in this technology. And that these studies have really validated the fact that this vaccine is very safe and that is very effective.
And Valeria, en español sería, los estudios de la vacuna se han hecho desde hace más de 20 años. Lo que tenían era como un molde, que es ese molde que lo único que necesitaba era ponerle como el otro ingrediente para poder hacer la vacuna. O sea, no es nuevo, ya el molde existía. Lo que hicieron ahora en el último año fue ponerle ese otro ingrediente para producir la vacuna. Por eso pues salió tan rápido y es un gran avance para la ciencia y la medicina, que hace unos 100 años jamás se podía imaginar uno que en un año iba a salir una vacuna. Y ahora, por los estudios que se van haciendo, y si sale otro virus como este, lo más probable es que la vacuna vuelva a salir en un año, porque ya tienen el molde. Lo único que tienen que es cambiar algunos componentes del molde.
Thank you guys so much.
Great questions. We have more questions coming in. I'm going to try to answer or have them asked in order. So we'll go to Christina next. You are able to unmute now and ask your questions.
Thank you so much for taking the time. And this is for whoever would like to answer. Right when we're at the cusp of spring break, what is the fear that we would have a resurgence, or the likelihood that we would have another peak during this time?
I can start. I'm very afraid personally about spring break, and more in a state like Arizona, more in a place that we have Scottsdale, where there is a lot of people coming for the spring break. And what we have seen in Scottsdale in the past has been that bars are not closed. And there's a young people that are coming to gather each other, and they don't care about the rest. So this is going to, if we don't control this is going to, again, to spread, because we don't have enough people with immunity.
And I would add that this is why we need our leaders to lead by example. When we are sitting here speaking about the importance of discipline, but we have our state legislatures talking about how, oh, we should just let businesses decide that they're not going to enforce masks, which is actually not protecting their workers' safety. What message are we sending to the community? We're not sending a message of discipline. We're not sending a message of being selfless and doing what's best for the greater community. We're sending a message of everybody just do what feels good for them, and your rights supersede other people's rights, and that's the problem. So as a physician, we are constantly battling with a lot of priorities. We understand financial issues. Every day we deal with wanting to prescribe medicines for our patients that they may not necessarily be able to afford. We know that there is a push and pull when it comes to economy and safety and quality of life. But as somebody who's personally seen people die with COVID, and as for me seeing pregnant patients suffering with COVID and dealing with those things, which nobody wants to have to see, we need our leaders to come out and with action show that they respect this virus and that they are going to do what needs to be done to get us through that last stretch. We're almost there, but we won't be almost there. All it takes, like you asked so appropriately, all it takes is one spring break, and we will, and a lot of the benefits that we have seen from being vaccinated and everything else is going to go out the window. And then the businesses will once again be decrying how much business they're losing, because that's what's going to happen. So for short-term sacrifice for long-term gain is what we want everybody to understand, and we need our leaders to model that.
Great. We will go to Shaylee and then Liliana. Shaylee, if you'd like to ask your questions now.
Sure. I have two questions. The first one is for Dr. Mills. So there was a story that made national headlines when a woman in New York, she was fired because she was refusing to get a COVID-19 vaccine. She emphasized she's not an anti-vaxxer. She was just working to have a family, and she'd been planning to have a child for about a year. And she was concerned because there's not a whole lot of research on people who are planning for families. What would you say for other women in her shoes that have some reservations about getting this COVID-19 vaccine right now?
Well, thank you for asking that, because part of the whole aspect of education is combating disinformation. The American College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine, the CDC have all come out months ago in support of this vaccine on pregnant patients, people trying to conceive, regardless of trimester. One thing that, along with many things that comes to light because of this pandemic that we needed to fix before the pandemic happened, was that we have a problem with including women in studies for pretty much anything, much less pregnant women in studies. And so ACOG has been trying to advocate for women being included in studies at the very beginning, because women are a large part of our population, and we don't want to say that something is safe when we won't even study them. But when you look at the mechanism of action of the vaccine, there is no reason why the Pfizer and Moderna, I haven't read the Johnson & Johnson study myself yet, so I'm only going to speak to the two studies I've read. The Pfizer and Moderna vaccines don't have any way of impacting pregnancy. And as we know, there are actually vaccines that we give during pregnancy right now. And so we don't have any misgivings as a society, as a medical society, about vaccinating our pregnant patients. A lot of my pregnant colleagues have gotten vaccinated and happy to do so. And they've actually, even breastfeeding women have done vaccines, and they're actually been enrolling in studies where they study breast milk and everything like that. So right now we have actually a lot of information post the release of the vaccine about thousands of pregnant people who've been vaccinated, as well as breast lactating people who've been vaccinated, and we've seen a good safety profile. Our stance is that COVID-19 is devastating for pregnancies, devastating for pregnant women. And so we are more concerned, we lose more sleep about our pregnant patients having COVID than we are about them being vaccinated. So I would encourage anybody who's hearing this, who's trying to conceive, or who's already pregnant, or who's breastfeeding, please get first in line, run down, get the vaccine right away. You will help your obstetrician sleep a lot better at night.
Great information. Thank you so much. I really appreciate it. My next question is for Dr. Harrell. So I know Dr. Mills touched on this earlier, but since you're located in Tucson, Dr. Harrell, we learned just yesterday during a news conference with the Pima County Health Department that the COVID's UK variant has now been in Pima County for 3 weeks. And the director, was very solemn about that. And so we just found that out. And today we're talking about loosening restrictions. Can we talk about the UK variant right now in Pima County that's been here for 3 weeks, and who knows how many people have it?
Well, sadly, Shaylee, this is not a big surprise. I think that most health experts and most physicians really saw the writing on the wall when restrictions were not being enforced, when they were being enforced loosely, and when they were being gradually rolled back in our state. We could have told you months ago that we are going to see mutations of this virus. That is natural for viruses to mutate, and they will try and survive, and they will try and find all sorts of different ways around any sort of implementation that we have to protect our communities. So the fact that we were not implementing safety measures stringently enough and effectively enough, as well as getting enough folks vaccinated, really set the stage for these mutations to thrive in our community. So sadly, this is not surprising. The good news is that to date, the studies that have been done on all of the various mutations show that at least Pfizer and Moderna are still very, very effective in preventing infection and, more importantly, preventing severe COVID-related illness. So getting the vaccines is still the way to go. But this is why we are so concerned about rolling back important safety measures in our state and having super spreader events like spring break parties and people going out to nightclubs and going out to bars, because this is just one mutation. There are several out there. It doesn't mean that the virus cannot further mutate to the point that the vaccines are no longer effective. And that is something that is absolutely frightening to every health expert in this state.
Thank you both very much.
Great questions. We'll go to the question from Liliana with Univision. And she asked that it be answered in English and Spanish, please. She asked, what is your message to business owners since they still have the power in their establishments to keep capacity limited?
Oh, I can start. So I think that there's two components. It's the leaders, the politicians, leaders of the state making decisions, but also there is a leadership in the owners that can change things too. So what I will tell the leaders of the business or the business owner leaders is that limiting their capacity and mandating masks, even if this is not a state mandate or something that comes from higher politician level, it's very important to protect the people that works for you and to protect the community that you serve. So it's very important. In the past, we saw some business that mandate, even if there was no mandate in the state of mask, and that helps a lot. And there were more people going to those places because they know that those places were safer than others. So continue doing that until really in a nation we have a space to stop it. Lo que le diría a los líderes de los empleos que tienen personas que van a su empleo, que lo que tienen que hacer es continuar con los requerimientos, aunque los líderes políticos no lo manden. Y la razón principal es porque van a proteger a las personas que compran en su empleo, van a proteger a sus empleados y a la comunidad que le están sirviendo. Aunque los líderes políticos no estén en acuerdo o no hayan mandado algo, es importante que nosotros como miembros de la comunidad y más los líderes de los empleos pongan estas restricciones para que así podamos entonces decir en unos meses que ya podemos abrirla y los empleos esos van a ganar más confianza porque se preocuparon más por la comunidad que otros que solamente se preocuparon por seguir las instrucciones y ganar más plata en forma de decirlo.
Thank you. Another great question. I see Christina has a question too. And if anyone needs to jump off, I'm going to drop my email address in the chat box so you can follow up with me afterward with any additional questions. But Christina, please go ahead with your next question.
Hi. So my second question is on reopening schools. I know we're talking about businesses, but students will be going back to school after spring break due to the mandate. What are your thoughts on students returning to schools? Is there as much of a risk of spreading the virus by having students return full time? Can you please speak on that? Thank you.
So I can speak to this because I have 3 young children that will be returning to school because of the mandate. And fortunately, most of the people in my family, other than our children, are vaccinated. We've been very, very privileged to receive that vaccine. And so our little bubble is protected. I worry about the teachers. I worry about the other support staff there because I know many of the teachers at my children's school. I work very closely with them and with their health department. And what I can say is that there are many who have yet to be vaccinated and that they are at risk of developing severe COVID if they were to come into contact with it. Listen, from a pediatric perspective, we know that children spread illness. They spread it like crazy, like wildfire. So it is a no-brainer that children are going to go to school. They might be infected. They might even be asymptomatic and not know that they have the illness, but they are going to spread it. Most of the children will likely be fine because while there have been some severe cases of pediatric COVID, we know that the majority of kids actually fare very, very well. However, when they pass it to a teacher or they pass it to an administrator, or they passed it to the school nurse or to their bus driver. That is very concerning. And so I think that this was a little bit backwards in the way that it was implemented. What should have happened is that we ensured that every single member of school staff, of school boards, of the teachers, that all of them, bus drivers, the bus drivers are really affected because they're in a small enclosed space with a large group of children. They should have all received the vaccine before reopening schools, because yes, children still need the vaccine, but we know that they are going to fare much, much better.
And just to piggyback on that, I completely agree that this is the concern we have. I have 3 children in elementary school, and we were fortunate to put them in the online academy version of our school district, so we don't have to be pressured by the mandates that a lot of other parents are. But, that was a privilege that we were able to have. Not all districts have that option. I'm vaccinated. My husband was able to get vaccinated, but my children aren't. And I still see them as now vulnerable because, we protect them, but if they go out to school, now they may get sick. And the other thing is, this goes back to what we really mean when we call a worker essential. What do we mean when we say that somebody is important? Talk is cheap. If we want to make sure that we are ensuring the safety of not just our teachers, but our kids who cannot get vaccinated yet because the studies haven't approved them yet, we need to get our teachers, our staff, our bus drivers vaccinated. And, that's what we need. We need priorities to actually be in the right order. We need to make sure that before we jump the gun and open up businesses and pressure schools to reopen simply because they're not getting the funding that they need if they don't reopen. This is about funding. This is not about science. If we're not doing right by the teachers and saying, okay, we desperately want you guys to go back to school, so we're going to show that by putting you in a prioritization level that's going to get you vaccinated before you go back. That's where there's a disconnect. We're saying that we think teachers are important, but we're not prioritizing them getting protected before they go back. So we just need our leaders to put their actions in the way that their mouths are moving, because it's very hard for teachers and for staff and for essential workers who work at restaurants. If somebody walks in and says, I don't have to wear a mask anymore, that person has kids at home, kids who cannot be vaccinated. So not only is that person with their little cloth mask, which us as physicians know is not the highest grade mask, can bring the virus into them because they don't have the support of the business owner to protect them, to say, no, you have to wear a mask when you stand so close to my employee. They're also running the risk of taking that virus back home to their children who cannot get vaccinated. So we have to show that we do actually value essential workers by actually protecting them. And we have a way to protect them now that we didn't have last year. But yet we're still doing the same thing, like if we don't have a new option. And so we really, all of us would love our kids to go back to school. My kids miss being in school with their friends. But we need to make sure that we're doing it in a way that makes sense. And, as scientists, we want everybody to follow the science. Following the science is also going to get our economy back in swing. So we just really want our teachers to be protected and our bus drivers and our staff to be protected so that parents could feel more comfortable with sending their kids to school and know that they're not transmitting things back and forth. Essential workers can't take 2-3 weeks off if they're sick. Their jobs are in jeopardy. Their wages are in jeopardy. One kid going back to school and bringing it home to the family could be devastating. And we need to act like we actually acknowledge and respect that.
Yeah, and just one additional note to what Dr. Mills had just said. Not only do we need to be considering the essential workers, but we need to be considering their families as well. For instance, there's one teacher in our district whose spouse was just recently diagnosed with a late-stage cancer and is going to be undergoing chemotherapy. Well, by our current guidelines, that individual does not qualify for the vaccine. But if she were to bring that virus home and infect him, it would be devastating, absolutely devastating. So now she's being put in a position to decide, do I keep my job because I have to go back or I'm going to lose my job? Or do I, take the time away and not be able to pay bills and support my family. So these are the situations, these are the very real life situations that we're seeing. And it's really easy for a politician to just dismiss that for the sake of the economy. But as physicians, this is the type of stuff that we see and that we deal with because we're humanitarians first.
Absolutely. Thank you, Dr. Mills and Dr. Harrell. I am not seeing any other questions come in, so we will go ahead and wrap it up. But thank you, Dr. Harrell, Dr. Mills, and Dr. Correa for lending your time and expertise. We certainly hope that Governor Ducey and the legislature will take it into consideration moving forward. And thank you to everyone who attended and asked great questions. Again, if you have other questions or need a recording, please feel free to follow up with me after the call, and I will be happy to share those. Thank you all, and I hope you have a great rest of the day and stay safe.
Stay safe, everyone.
Thank you so much.
Thank you so much. Bye-bye.
Yeah. Thank you so much.
Thank you for coming.